and Mr. Wang Qiyang
首先，
from the Department of
蒋超良先生
Economy.
介绍全省
Now, first of all, let's give the floor to Mr. Jiang Chaoliang for a brief on the prevention control of this epidemic of Hubei province. I come to this press conference with a solemn mood. Since the end of last year, the coronavirus pneumonia broke out in our province, causing major damage and cost to the lives and work of our province. My condolences are with those who tragically lost their lives in this process. Currently, on a daily basis, the number of our confirmed cases is still growing. We're still facing daunting tasks ahead of us. Today, from 0 to 12 o'clock, 313 new confirmed cases were reported. Since the outbreak, General Secretary Xi Jinping attached great importance and has made important instructions, and give important orders, and have held a standing committee meeting to give instructions to prevention and control of this epidemic, which lays a solid foundation for our work. With the commission of General Secretary Xi Jinping, Premier Li Keqiang visited Hubei province to supervise our work and made instructions that we have to give priority to the supply of the medical materials. The Central Leading Group also visited Hubei province to investigate on this situation, and the resources all over the country were mobilized in support of Hubei. And in these difficult times, the advantage of our system has been demonstrated. The PLA and other provinces send medical squad in our assistance. Hereby, on behalf of the provincial government and CP's Provincial Commission, I'd extend my sincere gratitude to our people in our province and in our whole country. Right now, more than 6,000 medical staff and more than 50 medical teams came in our assistance. Our medical staff are fighting on the front line despite the fact that they're putting themselves in a risk. Wuhan and Hubei are not fighting alone. The epidemic is a battle that we have to win together. In this battle, without bullets, the Provincial Party Commission will continue to act upon the instructions and a command given by the central government and CPC Party Central Committee, and identify the prevention and control as the most important affairs on our table right now, and we're determined to win this battle. Work at all fronts are pushing forward in an orderly and urgent manner. I believe that with the instruction of the Central Party Committee, with General Secretary Xi Jinping at its core, and the advantages of our system, with the advancement of technology and a strong national economy, we are fully confident that we will be able to win this battle in the end. Thank you, Mr. Jiang Chaoliang. Now the floor is open to questions. Please identify yourself before asking the question. with CMG and CCTV. I have two questions. First, Wuhan have closed down its cities for about a week, and in some places they blocked the road in order to prevent Wuhan returnees from going to their regions. And second, we understand that there is still a short supply in terms of medical resources. One doctor from the Hubei hospital pointed out that they are running out of medical supply. So what are the situation in these hospitals in Wuhan? First question. We take a lot of compulsive measures that starts at a good point. However, we still need to discuss the ways that we implement these policies. I want to apologize for some of the mistakes that we made in work. During Spring Festival, it's our custom to visit our friends and families. However, according to epidemiology, and faced with the daunting task of prevention control of this disease, we have taken strict measures to control the flow of people. From 10 a.m. on the 23rd, we have closed all access outbound and inbound of Wuhan and halted public transport in order to control the source of infection, because that is the best way to cut the channel of spreading and prevent this disease from spreading further. And the private vehicles have already been forbidden from going onto the street, and strict personal administration have also been exercised. As is known to all, Wuhan is the epicenter and main battlefield of fighting this epidemic. So we have to prevent both the spreading in and outside of the city. The prevention control of Wuhan is key to the whole picture. So we took this decision after very painful discussion and decision, taking into consideration the health condition of people of our whole country. After these measures were taken, we try our best to protect the market orders and ensure sufficient market supply. What touches us the most is that our residents have given us the utmost support. Online, I saw a very touching song. The lyrics reads, "This is my hometown, and I will defend it. And if one day it needs my help, I will do it." Like one of our residents also said that my city is right now sick, but I still love it. The Hubei people have this kind of loving spirit in their heart, and the city of Wuhan is heroic. We have overcome the major flood in 1998 and the SARS in 2003, and we are bound to win this battle against the coronavirus pneumonia as well. The provincial government and provincial commission are considering picking up our residents that are left estranged outside this city, and we also want to ensure and want to thank our other provinces for taking our residents in. we are waiting and expecting our people to come back to their home.
各位领导，晚上好，我是人民日报的记者。我想请问一下各位领导两个
With
问
Zhenming
题。
Daily,
一个是我们现在湖北的
two
各个地
questions.
方都出现了新型冠状病毒
First,
导致的肺炎疫情。
all of the cities have reported the confirmed cases. What are the measures taken by these cities, especially in rural areas, to spread the epidemic from spreading, to stop the disease from spreading further? And as of yesterday, many drugstores have reopened. However, there is still a very severe short of supply in terms of masks or even flu drugs. So will that situation be addressed in a short period of time?
这个问题请我们方案先生回答。好，今天我刚从孝感
I just came back from Xiaogan.
从孝感我们看到
In Xiaogan,
我们省4州的这个防控
I saw that we still are facing with daunting task in the 17 cities.
都已全部发现了确诊病例。
Confirmed cases were reported, and the number is still growing.
在农村地区，疫情防控
I also worried that in rural areas, the prevention and control of the epidemic face more daunting task because they have relatively poor infrastructure and awareness. Once the disease began to spread, it will be much much more difficult to get it under control back again.
在各4州
So
广泛的发动起来了。
all of these cities and the government were fully motivated to upgrade their prevention control methods and have tightened all of these prevention control measures.
采取切断传染源。我们科学实测
We should first of all cut the source of infection
冠状病毒肺炎
because the coronavirus pneumonia
切断传播途径。
and its dissemination
医生
is
4州的收治
can be most effectively cut off by this cutting by the stopping of
传染病医院改建一批
by the curb of the source of infection. We have also renovated hospitals to make sure that all the quarantined cases, including confirmed and suspected cases, can be admitted into hospitals. So quarantine first, test second, and treatment third. And that is the best way to prevent cross-infection from happening. Right now, we are also speeding up the establishment of designated hospitals, and we are also mobilizing resources, including schools, hotels, and as backup quarantine locations.
黄冈版的小汤
On the 28th, the Huanggang version of Xiaotangshan Hospital began to operate with more than 1,000 hospital
全
beds
省其他4
outside
州
Wuhan.
改扩建或者征用的医疗机构
The
70
total
家。我们采取的第3类措施
number of newly established or renovated designated hospital amounts to 70.
控制好返乡人员是关键。
In rural areas and in community, it is of paramount importance to control the returnees.
所以控制从
In one county, there might be as much as many as 60,000 people that returned from Wuhan. So that's why we have to strengthen this great administration as well as joint prevention and control. In each village, in each community, the cadres, the village doctors, and health workers organize special teams to test, to check body temperature, take registration for the returnees on a daily basis. Once abnormalities were found, and we have to report these cases, sterilization, quarantine, and all efforts must be put into treatment as well. In rural areas, most of the residents are lacking knowledge in terms of prevention and control. That's why we have issued this manuscript for prevention and control by sending out messages, making calls, or send out flyers to the villagers in order to improve the environment and regulate farm markets so as to rule out the possibilities of further spreading. We also need to strengthen protection of health workers, make sure of the sufficient supply of medical resources. We have implemented targeted measures, especially in the rural areas. For example, we have renovated some of the hospitals and strengthened leadership and strengthen the publicity work, especially the general knowledge of this disease. And the provincial leaders have already go to all of these cities to play the leading role as the inspector of the control and prevention work. And also in terms of medical fee, as well as the renovation fee of the designated hospitals, are all allocated from the central provincial budget. We also will strengthen supervision. In rural areas, there is a problem of formalism. So strengthening supervision is important to root out formalism.
几个提问。这位男士。我是法制日报的记者，我关注到呀，很多群众反映
With Legal Daily, according to some report, it is right now still difficult to get admitted and get diagnosed. So, do we have any measures to address that problem? Today, as of right now, we are experiencing the peak of the outbreak in Hubei province. We are also experiencing a peak in the general flu as well as respiratory disease. So it's an overlapping period of these three peaks. That's why we see long lines forming in hospitals, especially designated hospitals, where hospital beds are in dire need. So we take three measures. First is to speed up the renovation and expansion of existing hospitals and increase the hospital beds. We already have about 130 designated hospitals, 19 in Wuhan. We also have kickstarted the category category screening system. Community level is the first defense line of the prevention and control. The clinics at the community level should be the first stop for the screening of fever patients. And the medical resource at designated hospitals should be left for those who are with more severe and critical conditions. Third is to ensure the sufficient supply of medical resources. With the support of the national government as well as other brother provinces, we are right now restoring and speed up production in order to make up for the gap in the supply. We also have made coordinated arrangement and to cover all of these all of the other cities, aiming for the best result. Currently, the structural and periodical undersupply of medical resources are still very acute. So we still need to tighten our belt in order to give and send the medical resources to the places where they are most needed. We will continue to renovate the hospital so that it will be more suitable for diagnostic testing. Currently, on a daily basis, we can process about 4,000 kids. That is as a major increase to 200 kids at the very beginning. We will mobilize more institutions and qualify them to do the diagnose so as to speed up the screening of the suspected cases. If they do not qualify, and we can just free this part of medical resources as soon as we can and use the medical resources to treat the coronavirus patient. So we see an increase of suspected cases in these days, and we are in the process of overcoming the long line and the shortage of hospital beds.
第二排这位来。
中国新闻社的记者提问，我还是接着前面的记者
With China
问题，
News
就是各地现在
Agency
都出现了医疗物资紧缺的这个情况。医院今天我们看到这个协和
In terms of the short supply of medical resources, we saw that many major designated hospitals are calling out to society for donations of medical resources. So what is the production situation in terms of the medical resources inside the province? Thank you for the question. That is a matter and of crucial importance and a pinpoint of our work. Because at the front line, we are experiencing a short supply in terms of N95 mask and protection kits. The resource is really, really scarce and limited. I'm now in charge of medical resources and material supply. So we have opened up different channels to increase supply. At the national level, we ask for national support. We also call out for other provinces to come to our aid. We also mobilize the general public to make donation in support of us. We also have mobilized the enterprises within our province to restart their production. And this is a labor-intensive industry. During the holiday, many of the workers have already returned to their positions in order to restore production as soon as possible. I think it's not an easy thing to do for the local governments and the enterprises. And bonuses were involved, of course. The wages are tripled or even quadrupled. a lot of the workers are working under 2 shifts or 3 shifts a day. And there are many touching stories. There are already 2 manufacturers of protection suits, and more than a dozen manufacturers of the protection gears are restoring their 100% capacity. The government will also be providing them with the necessary materials and other production factors. Some of the materials can be found inside a province, for which we ask this upper value chain manufacturers to also restart their production if it has to be transported from other province. We also would notify these enterprises and urge them to start production as soon as they can. In terms of transportation, green channels were opened up to provide favorable conditions for these enenterprises. In terms of foundation, we have allocated 122 million RMB to make sure that all of this is operating smoothly. We also have strengthened sterilization and health protections.
这第二个，第三个的话呢，是积极的争取相关的机构的支持，那么破解我们的国标、欧标、美标还有日本等国家的标准，去我们国家的这个差异。
Trying to understand this difference between for example, Japanese standards, American standards, and European standards, and the production line need to be connected and reconnected with GB standard, because some of the manufacturers are actually the production base for foreign enterprises. So the GB standard enterprises need to be taking the leading role, and the other contracted manufacturers can be the manufacturer, can be the provider as well. I believe that in about 2 to 3 days, our production ability of protection gear would amount to about 20 to 30,000 a day. So we're pulling all of our endeavors into this effort. With Hubei daily, we see many the outbreaks at many places in the province. In hospitals, I heard that the medical staff can only have access to 2 masks on a daily basis. So how are the medical resources allocated in order to meet the need of the health workers? It's actually an extension of the former question. It's a pain point for us. It's a focus of our work. The epidemic is developing very fast in terms of protection suit and masks. We are continuing to running under supply. So right now we have to prioritize and try our best to increase supply and allocate the resources in a more sensible manner, so that the most needed resources can be sent to the most needed place. So standard confirmation is very important. In many hospitals, they're asking for aid and donation. the gap does exist,
没有标准。那么就是医院里头，
but
到底是哪些场合
there's
哪
no
些岗位
standard in what kind of location at the hospital or position at hospital are in need of such protection suit.
有点乱
And
呢，也是一个原因。大家不明确，
in the
大家
past,
都想
there is no clear standard as to the protection level for different position at the hospital. It is not possible to ensure that every medical worker in a hospital can have access to the protection
常见
suit.
医用防护
So
用
on the
品应该是哪
26th,
个
we have a
各
guidance
个岗位啊，不同的
for
医院不同的岗位，
the
它配备
different
这个
level of
提供了一个非常好的
protection
指引。
for different
我们可以说的
positions
话呢，立刻
at the
消化
hospital.
细化
This is
这
very
个规则
clear
然后
guidance.
呢，这个制定了主
We
要用
have
于啊
further
主要
specified
医用防护用
these
品
guidelines
日配备标准啊，就把这个标
and
准细化
have
之后，
set out the standard for daily deployment of medical resources. With such a standard, our work can be advanced in a
因
more
为疫情也在变化，
smooth manner.
这个除了武汉
With
之
the
外，
epidemic
其他
changing
地方的这些这个
besides Wuhan,
患者的数量的话呢，也在不断的变化。
other
建立了
cities'
医疗
number of
信息报送
patients
机制
are
那么
also
每天医
increasing.
疗保障
So
组
we have
医疗保障组
established this filing system
这个医疗组，
in
医
our
疗组呢
group.
就根据各地报出的这个需求量啊，同时根据各地方
We will do
这
the
个确诊的病例
allocation
一次的
according
病
to
例
the
有关的
number
人数发热
filed
的人数
by the
有个的标
cities,
准，在统
namely
一核
that
算。
is the confirmed cases, suspected cases, and
那么需要多少？当然有前几天特别是
number of close contacts and medical observations. In the last few days,
这个
we still have a short supply.
配给相应的单位啊，配给相应的单位。
After calculation, so we have to
第三个的话呢是严格按
give
这个
do this kind of deployment according to a certain percentage.
有了人数，有了对数字的
With the standard, with the filing system, with the numbers that are provided by the filing system,
比如说啊，今天的话
we can make this allocation standard. Take today, for example.
晚上还会有啊。到目前为止的话，有12400套。那么根据这个比例的话呢，
We altogether have 12,400 suits, and 889
详细的做的这些。
suits are
那
sent
么
to
第三个的话
Jingmen
是到货
City.
后
So
以后
that's
快收
right now
快
our
发
daily work.
物
So
资的
after
分配
we have
发放
received
啊
these
由国家审
resources,
批
we
储备采购
exercise
企业
speed
负责相应的物流推
reception
送
and
这个
speedy
是比较专业的
reception
这些
and
物品的话
delivery.
也不是一
We
般的
have
这个
special
能够做
delivery
这个到
companies to
了
do
武
that
汉的物
because
资我们是
not
2个小
every
时之内
delivery company can do
分配
this.
完毕，然后物流企业
Through this
启动
fast
送货
delivery channel,
每天晚上每天
we
晚
have
上
to
这
do
几
the allocation within 2 hours,
这个
and
这个
each
这个
night
中央督导
the
组的做
delivery
每天晚上最后
service
一
provider
定要追踪到哪个医院你收
will
了多少
send these packages to certain hospital, and the number will be traced after this delivery.
日清日结。那么所有
And
的
that
这些程
sums
序的话
up
呢
our daily work.
都是这个
All
按
of
照这个
these
过程
processes
这么一个
are
公开透明
operating
这样的话呢
according to the standard that and process I've just mentioned.
也发给这个督导组啊
And this list will also be reported to the supervision teams as well as provincial
汇
leaders.
总啊，这个也向市州各个指挥部公开接受监督。所以直到现在
The
为止的话
numbers
呢
are
医
also
疗
made
防护物资
public.
这个供应
So
短缺的这
currently,
个状态还没有完全
the
克服
shortage
这是我们内心的话呢
of
非常
medical
着急。
resources
这个
have not been fully addressed. We are also very worried ourselves.
这个
But the only thing we can do is to increase
这个医
supply
护工作
by
者是
all
我们抗
means.
击肺炎的中坚力量。
because the health workers are the first line of defense. If they are not well protected, it will make it that much more difficult for us to win this battle. There's still an acute problem between supply and demand. We accept all criticism, and all we can do is to pull in all endeavors to increase supply and send the most needed protection gears to the hands of our medical workers. There are several hospitals are calling out for help to the society for donations. The resources in Wuhan city must be carefully allocated and sent to these key hospitals.
你好，我是湖北广电记者。我的问题是这个目前防护服等
With Hubei TV.
但据我们所知，也有不少的社会捐赠。
In terms of the shortage issue, to address that, there are a lot of donations from the society. So what are the most needed medical resources? We did receive a lot of donations from other provinces and enterprises, businesses, and even overseas Chinese. Many donations were made, especially a large number of medical resources. As of 12 o'clock today, the Red Cross and the Youth Development Foundation have received 6.1 million pieces of donation. Many are the most needed resources, including more than 26,000 protection suits, 470,000 masks, and 1.2 million disposable masks, and 39,000 protection lenses, protection glasses. The designated donation have been sent to the designated location. The rest is allocated through the commanding center. And Mr. Cao have given you a very detailed process of allocating these resources. You can refer to their official website for the details. Mr. Cao also mentioned that we are now experiencing short supply, so we blame ourselves for our inefficient work. Coming up, we will continue to strengthen our work, urge the enterprises to restart their production. Right now, we are still lacking protection glasses, masks, and ambulances, as well as protection suits. So we urge that our friends from the media to continue to call out for social help. We also plead for more donations from all walks of life.
各位领导好，我是中国日报的记者。刚才曹省长呢提到了
With
就是
China
我们
Daily,
这个防护服的生产有欧
so
标、
Cao
有美标
mentioned
还有国标。那么欧标和
we
美标
have
和
a
国标有很
European
多不同。
standard,
我们
American
这边呢
standard,
在
and
实地的
GB
一线
standard,
工
national
厂来
standard,
发现呢，就是咱们湖北生产的防护服
and they are
很多
quite
都是欧标的。
different.
那么我们想问一下，这个
So
问
the
题我们在具体的情况下是怎样解决的？
protection
这个问题
suits.
请
A lot are
先生回答。谢谢您的提问。
meeting the European standard.
这个医用防护服啊，可以说
So how do we address that kind of paradox?
当前最
That's a very important question. Protection gears is the lifeline for frontline workers.
昨天啊，也就是1月29日。
So we have made special arrangement.
刚才提的
The
这个问题
MIT have issued
规定了
a
当
document
医用防
to
护服
specify this problem.
可以呢
When there's
使用
in short
紧急
supply,
医用物资防护服。
emergency medical resources suit can be used
非常明确
as a substitute.
严格。只要
It's
符合
very
欧
clear
标
stated,
EN
according to the document, as long as it is up to the European 14126 standard and European CE ratification,
标准的喷雾致密性防护服，符合标准的防固态可
and other important European standard against the
在
production of liquid and spray.
和隔离
These
地区
protection suits can be used in quarantined ward and red zone.
用防护服必须呢
Of course,
有重点
the
企业
domestically produced
为此呢
protection suits must be produced by certain qualified manufacturers.
其中呢我们的湖北
10
检
enterprises
讨育成无航部
were identified as qualified by the MIT. There's one in Xiantao.
名列其中。这一重大举措啊，充分体现了中
This
央对湖北的
has showcased that the central government shows great support
开走马
in our province. We also urge these two
欧标医用防护
enterprises to speed up their production in order to produce more protection suits.
的标识。
And this is only for emergency
刚才我
use.
说的那两个区，隔离留观病区和隔离病区这两个区
So
呢
for the quarantined ward zone and quarantine for observation zone,
我们的国标的防护
the medical staff can use these standard suits instead of national standard
更好
suit,
的确保刚才司机
so that the national standard
同区
suit can be effectively allocated
当
to
然
the
了
red
对
zone.
应临时的应急措施，在这次疫情结束以后呢
Of course, this contingency plan will be
好，由于 时
will
间关系
be
啊，今天提
dismissed
请这个
after
第一排。
this outbreak. Last question.
我是新华社的记者。习近平总书记强调，
With Xinhua News Agency, General Secretary Xi Jinping pointed out
高高飘扬。
that
我们的记者在采访中了解到啊，
the
党员在一线尽职尽责
party members must be playing a leading role.
一问三不知。我想请问的是，在湖北
However, we found that some of the party members are quite ignorant when it comes to key
蒋太
statistics
郎先生回答。
of the epidemic. So, do you have any comment on this problem?
这是抗击疫情这样一个战斗中，
During this combat against the coronavirus pneumonia,
党员干部冲锋在第一线，领先去了。
most of the party members are working on the front line,
党员干部
and you can see a lot of touching stories.
舍小家为大家，
They are fighting on the front line, regardless of their own safety
武汉新
or even that of their
他们跟我说，
family members.
医院的党委副书记
When I was visiting the
当地的妻子对新型冠状病毒
the Jingtan Hospital,
住院，
I learned that the chief of this hospital,
患重症，
Mr. Zhang, was diagnosed of ALS, and his wife was diagnosed as nCoV pneumonia. However, when the pneumonia breaks, he still insisted that he continues to work in the front line and continues to work for 30 days so far. And yesterday, we are very glad to know that his wife was now discharged, fully recovered and discharged. So on behalf of our Hubei people, I'd like to extend my sincere gratitude for all of the health workers who are working at the front line of fighting this coronavirus pneumonia. That is my highest gratitude goes to all of you. When are exercising collective prevention and control, the party organization at a grassroots level also would have to be the front line, the first defense line of the health and safety of the people. I visited one of the communities near the Hankou hospital to do the inspection work, and I met with one senior citizen, and she told me that she was suffering from heart disease. So I dare not go to the hospitals. That's why I ask the community cadres for help, and they have helped me to pick up my medicine from the hospital. This way, I myself do not have to go to the hospital to pick up this medicine, so as to avoid the risk of catching the pneumonia. We're also right now building the Leishenshan hospital. The China construction company have organized a squad formed of party members to act as the pioneer in the construction of these two hospitals. And these hospitals will be completed in a few days. I believe that with the leadership of the Central Party Committee and the participation of all party members and the synergy of our people, we are determined to win this battle in the end. What I really want to express is that I understand that you've been working very hard doing interviews and writing up reports. You have been a great help to us. My highest tribute goes to all of you. And also plea that you protect yourself well and take care of your health condition. It is only through joint endeavors can we overcome the difficult time and overcome this epidemic. Last but not least, let us work harder to win this battle. That's all for today's presser. Thank you all for joining us.